Welcome, everyone. Today, we're diving into the incredible world of psychiatric nursing. It's one of the most complex, but also one of the most rewarding fields in all of medicine. So we're going to explore how these amazing professionals navigate the inner world of the human mind.
So let's start with the big question, right? What does it actually take to care for the mind? This isn't like setting a broken bone. The challenges here are, well, they're on a whole other level, and they start with some really significant barriers.
And the first big hurdle? It's stigma. And this isn't just one thing, it's kind of like a triple threat. You've got public stigma, that's the prejudice from other people. Then there's self-stigma, which is when people start to believe those negative things about themselves. And maybe the most heartbreaking is label avoidance, where people are so afraid of being labeled that they avoid getting help in the first place.
On top of all that, you have to remember that patients in psychiatric care can be incredibly vulnerable. Their illness might make it tough for them to make good decisions, or to trust people, or even just to speak up for themselves. This puts a huge responsibility on the nurse to be a protector, an advocate, and a really trusted ally.
And this, right here, gets to the absolute heart of the challenge. See, unlike a cut or a broken arm that you can see, the wounds in mental health are internal. They're invisible. So the nurse has to be the skilled navigator of an unseen world, using empathy, skill, and a very specific set of tools, starting with a rock-solid ethical compass.
Yeah, every single decision a psychiatric nurse makes is guided by this unwavering ethical compass. And look, these are just some fuzzy, feel-good concepts. These are the core principles that make sure the care they provide is always safe, always respectful, and truly effective.
First up, we have autonomy. This is simply the patient's right to make their own choices. Even when someone is really struggling, empowering them to choose something, anything, from what to eat for lunch to their own clothes, helps them hold on to their dignity. And more than that, it's how you start to build trust, which is the foundation for everything else.
Next is beneficence, which is the duty to do good. But what's really important here is that it's more than just being nice. It's about expertly blending the science, the right medications and therapies, with the art of genuine compassionate care. You put those two together and you create an environment where healing can actually happen.
And of course, there's non-maleficence. First, do no harm. In a place with such vulnerable people, this is huge. It means actively avoiding anything that could cause more trauma. Things like being judgmental, using restraints improperly, or just ignoring someone's emotional pain. Safety is always, always number one.
So this leads to this constant, delicate balancing act. On one side, you have autonomy, the patient's right to choose for themselves. But on the other, you have paternalism, the nurse's duty to step in and make decisions for the patient's own good, especially if they can't safely do it themselves. Navigating that tension, that's the art of ethical psychiatric nursing right there.
Okay, so with that ethical compass pointing true north, the next job is to actually understand the patient. But here's the thing, you can't just look at a diagnosis on a chart. To really help, a nurse needs a map that shows them the entire person.
And that map is called the biopsychosocial model. It's broken down into three parts. First, the biologic part, which looks at physical health, because, the mind and body are deeply connected. Second is the psychological part, where they dive into the person's actual thoughts and feelings. And finally, there's the social part, which considers their whole world, family, culture, community support. You've got to look at all three to get the full picture.
All right, so our nurse has their compass and their map. Now what? What tools do they actually use to help someone build a path toward recovery? Well, there are a ton, but let's look at a few of the most important ones.
A huge one is milieu therapy. And the basic idea here is powerful. The environment itself is a form of treatment. It's all about creating the structured, safe, and supportive community where patients can feel secure enough to start healing. That therapeutic space is absolutely crucial.
Another really powerful tool is cognitive behavioral therapy, or CBT. Now, what's so amazing about CBT is how empowering it is. It literally gives patients the tools to recognize their own negative or distorted thought patterns and then work step by step to change them. It's about learning how to rewire your own brain. How cool is that?
But in any of these situations, safety has to be the top priority. And a critical skill every psychiatric nurse has to master is de-escalation, the ability to calm a tense situation before it turns violent. It involves a whole set of techniques, things like respecting personal space so someone doesn't feel trapped, using calm body language, and always being aware of your surroundings to keep both yourself and the patient safe.
Now we have to talk about one of the most serious and difficult situations a nurse will ever face, suicidal ideation. This is way more than just a fleeting thought. It's a true psychiatric emergency, and it demands an immediate and very careful assessment.
And that leads us to this incredibly difficult, incredibly human challenge. How do you ask someone if they are thinking about ending their own life? It takes an unbelievable amount of both courage and clinical skill, and there's a very direct, very specific way you have to do it.
So this is the clinical standard, and it might not be what you think. See, in these moments, trying to be vague or beat around the bush is actually dangerous. Nurses are trained to be direct. Asking these specific questions about a plan, about the details, about the means to carry it out is the only way to truly understand the immediate risk. Answering these questions is what allows a nurse to step in and, quite literally, save a person's life.
So, after all of this, the ethics, the assessments, the interventions, where does it all lead? What's the goal? Well, it isn't just about managing symptoms. The real goal is something so much more hopeful.
This right here might be the single most important idea to take away from all of this. In modern mental health care, recovery isn't just a long shot or a vague hope. It's the expectation. That is a massive shift in thinking. It reframes mental illness as something that is treatable, not something that defines a person's entire life.
So what do we even mean by recovery? Well, it's a process that's filled with hope. It's holistic, meaning it involves the whole person, mind, body, and spirit. It's an empowering journey where the person is in the driver's seat, supported by friends and professionals. And above all, it's a journey that is completely grounded in respect.
And that brings us right back to where we started, doesn't it? That whole journey of recovery is made so much harder by stigma. So the question I want to leave you with is this: what can we all do in our own lives to help break down the prejudice and fear that so often stands in the way of someone's healing?